Hey, thank you so much to everyone for tuning in today. Michelle Richards and myself, I'm Alicia Shickle from Garfunkel Health Advisors. We're here today to discuss with you some strategies around improving your medical record, and we want to talk about some efficient coding strategies. Again, today our objectives, we really want to just discuss some best practices for improving the medical record, both from the perspective of the medical record in general, your conditions for coverage, all the requirements in the medical record components. We're also going to talk about the medical record and how that is important for efficient coding practices and supporting medical necessity and your revenue cycle. And then hopefully we're going to have some great takeaways that you'll be able to take back to your practice and implement in your day-to-day workflow there. Great. And then, so we're going to run about 45 minutes or so. We want to make sure we leave plenty of time for question and answer at the end of the presentation. So not sure if you've tuned in to any of our presentations before. I'm Alicia Shickle, about 36 years in the industry, working both in clinical and administrative roles. I have a lot of my background really and experience focuses around revenue cycle, documentation, coding, compliance. I do a lot of work with providers, unfortunately, who are in defense mode. So this topic is a very, very passionate one for me today, the medical record. And we'll talk about why, and we'll share some great experiences with you as we go through the presentation. Again, just, I'm an accredited healthcare fraud investigator, certified in coding and healthcare compliance. I want to introduce you to Michelle Richards. She's recently joined our team here at Garfunkel Health Advisors. She's our new Director of Client Engagement. Michelle and I had the opportunity to work together years ago. We both worked in the compliance department at the American Academy of Professional Coders. So Michelle, you want to talk just a little bit about your background before we kick off?
Sure. Hi, everyone. Thank you so much for joining us. As Alicia said, I'm Michelle Richards, and I do bring 30 years of healthcare experience. That is in documentation, coding, auditing, human resources, credentialing, revenue cycle integrity. I also do proactive and reactive compliance, and I do prefer to be like this on the proactive side. And I know how important it is for AmSurg Center administrators to understand how imperative medical record documentation is. And we hope that you enjoy this presentation.
Definitely. Wonderful. Yeah, so, just stepping back for a moment and reminding ourselves that the medical records are legal documents, right? And they are subject to state and federal laws. And I think that's a critical component to remember as we go through the standards. Today, we're going to talk mostly about CMS's conditions for coverage. And while we know there are so many, we're focusing on just this one element today, the medical record component. Again, really important, that the surgeons and all of the healthcare professionals who are documenting in the record are doing that systematically, making sure you're capturing all of their information, both history, around their illness and injury or conditions, and then as well as the care and services that they're receiving as a patient while at the center. We're going to talk about this many times. You'll get sick of hearing it probably, but really critical that the documentation is complete, that it's comprehensive, and that it's accurate, right? Both for ensuring adequate patient care, but also later in the presentation when we talk about coding and revenue cycle, making sure the documentation is there to support all the services that you're billing for. Again, one of the requirements here, I want to point out this little word must here. We're going to see that must and should throughout the presentation. And when you're looking at regulations, when you see the word must, that means it's mandatory. You must have that in the record, as opposed to when you see the word should, then that's more of a recommendation geared towards more of a best practice type recommendation. So here it says the ASC must develop and maintain a system, an overall system for proper collection, storage, and use of the patient records. One of the things under the federal regs, there's nothing really that says, record retention requirements. So we are just recommending that you defer back to your state on what the state requirement is there. This is one area I'm going to ask Michelle to talk about. There are multiple sources of regulations and oversights when it comes to documentation. Michelle, you want to just kind of jump in and kind of go through some of these different areas?
Sure. And as Alicia is talking to you today about medical records, I want you to think of medical records as the pieces of the patient puzzle, right? And those pieces are under scrutiny, and they need to be. There's multiple sources of regulation and oversight. So you have your state licensure regulations, your Medicare conditions for coverage, your state operating manual, accreditation standards, nationally recognized standards and guidelines, standards of care. And, while it's not really considered a regulation, best practices should also be adopted when appropriate. You're going to have varying times of when you need to document. You could be documenting daily, weekly, monthly, quarterly. There could be some documentation that's going to be required annually. So it's very important that you understand what these variable requirements are.
Like that's not enough oversight, right? We don't have enough to do. We have to follow everybody's rules and recommendations here.
Right, exactly.
Great. So here's another, we just want to dive into these, the Medicare condition for coverage. And this is where you can find that in the state operation manual. We really want to bring this information to you. And as we go through the components of the medical record at a high level, I think it's really important to understand from a compliance perspective, what are the surveyors looking for when they come out to do your survey at your center? It's great to say, you have to have patient identification measures, but what does that really mean? So we want to take you through the actual components of that. Again, you see here, CMS conditions for coverage says the ASC must, so these are requirements. Again, complete, comprehensive, accurate record. Documenting timely is really critical. I'm going to talk about that. And there are some very specific requirements of when certain pieces of the puzzle or the medical record have to be reviewed and signed off on, right? So that's going to be an internal control. We're going to talk about some controls around that. Again, using the information contained in the medical record to make sure that patient is the care is being delivered adequately to patients. And then you also have an obligation. You must ensure the confidentiality of each patient's medical record. Okay, so not only that, you have to have a system in place, but every patient has to have the unique medical record. And that's pretty much a given, right? Each patient has their own chart. Every chart has to be legible, promptly completed. We know that, and here are the elements, right? So this is not an all-inclusive list of what must be included, but this comes from the conditions for coverage. So it says basically the medical records must include at least the following, right? So the first element under the CFCs on medical records is the patient identification, right? And here's what the surveyors are looking for. Here's the protocol. There's multiple ways, right? Through patient identifiers such as their name, their date of birth, their social security. The second element is a significant medical history and results of physical examination. And if you notice here, there's a little as applicable, right? This has been a recent update that history and physical now can be deemed as, or mandated, deemed as clinically appropriate by the provider. So the provider gets to have a say as to whether this is appropriate for each patient based on the reason why they are presenting to the center. Okay, preoperative diagnostic studies, if performed, of course, if you're doing any studies that have to be included, incorporated in the patient's medical record, that's going to be a critical component of patient care. Element number 4 here, and you're going to see how a lot of this is going to be applicable to the components that are going to be necessary when we get into the coding strategies. Findings and techniques of operation, right? And that includes any pathology reports on all tissues that are removed during the surgery, right? They're going to be looking for those. And we know that there's some very specific criteria around that. Again, these are just the major components of the medical record. They are not all inclusive within themselves of what needs to be contained under each one of these sessions. Okay, any allergies or abnormal drug reactions? Not only is it important to take the patient's history, but it's also a critical component to make sure that you're capturing any abnormal drug reactions that occur both during and after the surgery prior to the patient being discharged. Number 6 here, entries that are related to anesthesia administration, right? That's a very broad general statement. You have to have the entries related to anesthesia administration. Again, that's a comprehensive component of your record. There are a lot of elements that are required within those sections. Let's see. Michelle, you want to talk about this next 2 components here of the medical record, and we're going to get into, we want to take you through all the components, and then we want to look at some best practices and strategies to kind of help you make sure that all of these pieces are actually in the medical record.
Absolutely. So the informed patient consent is an imperative, important piece of the patient puzzle when it comes to the op note. You know, you need to have that informed patient consent. You know, did the provider meet with the patient and go over the indications for the surgery? What was the risks of the surgery? What are the benefits of the surgery? Could there be some type of alternative treatment programs? You know, any type of treatment measures. And also important is the discharge diagnosis. You know, documentation of the patient's discharge diagnosis is imperative, as well as where was the patient discharged? Were they discharged to the home? Were they discharged to a nursing facility? Was there any type of transfer to another healthcare facility? Emergent transfers to a hospital? This is all very important documentation that needs to be in the patient record.
Right, and not to be confused with the standard discharge instructions, you know, which is where you've got to give them their instructions for when they should follow up with the provider, and that's actually a whole another element of the record. Okay, when it comes to survey, right, the absence of any required element must be cited as a standard level of noncompliance. However, if there is one element where you're found deficient across many records, that may be elevated to a condition level of noncompliance, right? As well as the absence of a number of elements across a number of medical records. So really that comes down to the severity of the citation, and, you know, is that really widespread, is going to depend on the level of citation for missing information. Michelle, you want to talk through some of the common citations that we have found? Even, you know, GHA, we have a program where we help centers meet the requirements in New York State under their medical record consulting program. And some of these are deficiencies that we've found. And also Michelle's going to talk to you about some of what the CMS findings are.
Sure. You know, as we said before, you know, we have the proactive side and we have the reactive side, and this is a reality for all of you. This is the reactive side. We have had some common citation findings that are like no documentation of allergies or adverse reactions. The update is not completed. There's no documentation of pre or post procedural calls to patients. That doesn't mean that your ASC was not performing those duties, but it wasn't documented. And the old adage always goes, if it's not documented, it wasn't done. Possibly the update not dated and timed, update completed post-operatively. You know, we all know that's supposed to be done prior to the procedure, but sometimes it's not documented until afterwards. Reports not timely signed, and no medication reconciliation. That's such dangerous level right there. You need to make sure that you're, you know, reconciling medications so that there's no adverse reactions. Some other areas that we found that are not on this slide is like unapproved abbreviations. ASCs need to make sure that they have a listing of all the abbreviations that they use in their medical documentation. You don't want to have an auditor to try and decipher what your acronym means. And we all know the healthcare field, we have acronyms everywhere. Missing documentation of patient advance directives. What is the patient's wishes if something was to happen during the procedure? Missing signatures. We can't stress enough how important it is to have timely documentation and timely signatures. Missing evidence of post-procedural assessments, missing evidence of discharge orders, and missing discharge status. Like I said before, the importance of the, transportation. Where did the patient go? There's no documentation. Did the patient just vanish?
Yeah, they jumped in the car and drove home. Great segue. And I know maybe it seems like we've rushed through the components of the record. Hopefully all of you are familiar with those conditions for coverage elements that are required within the note. And Michelle and I really want to focus on some action items that you can bring back to your practice to help you assure that all of those components are there and that your documentation is going to be compliant, both from the standpoint of your medical record requirements in general, what are you required to have in your medical record, as well as the content and details in that record that are going to help you back up your revenue of the things that you're billing for. So one of the first things we always talk about, so critical to do a risk analysis, right? Understanding what you're required to have it in the note, right? And we talk about risk as, what's the likelihood and probability of something happening? And then if that event does occur, what's the severity and impact of that, right? So really critical to understand what do you need to be looking at from a risk perspective. And then developing and implementing necessary policies and procedures. And we're going to talk a little bit about these as we go on through our discussion today. Educating your providers and your staff. Communication is critical to getting all of this right. One person can't do it on their own, right? We have to educate people. What are we holding them accountable to? What are our expectations? Daily monitoring, critical, right? We talk about auditing and how important auditing is for effectiveness. And we're going to look at that a little more in depth, but daily monitoring is critical because you want to be keeping your eye on things on a day-to-day basis to make sure there's no patient safety issues, that you are capturing everything in the medical records that you should be. Why? You want to be able to identify issues early, intervene early, put corrective actions in place, go back to the root cause of those issues, talk to staff, talk to providers, hold people accountable, and then, of course, re-education. We say, you see the wheel here, right? That's the cycle of life and compliance. You have to just keep it going. It's not a one-time deal. It's a living, breathing. All of these things are living and breathing. Having your policies, as Michelle, we laugh all the time. We're like, well, if we come in and your policies, as being used as a doorstop, well, that's not a good sign, right? So it's about implementing all of these things. And again, how do you improve, your medical records? All of these, by implementing all of these action items within your center, is going to be really critical. Michelle, perfect segue. Michelle has a lot of background in HR. She does a lot of work with providers around policies and procedures. Do you want to talk a little bit about the importance of those?
Oh, absolutely. You mentioned about the doorstop. Sometimes when we go in and we want to perform our audits, we'll ask the administrator for a copy of their policies and procedures, and they pretty much, go into this locked room and they grab this binder and they blow the dust off of it and they hand it to us. It's like, okay, that's not your policies and procedures.
Yeah.
Policies and procedures is a process. It's not documents, and it also sets the cultural expectations for your organization. You know, it's so important for a policy and procedure because it keeps everyone on the same page, right? You know right up front what the expectations are, and it needs to be accessible and shared with all employees. What good does it do if it's locked in a cabinet somewhere? Everyone needs to be able to access it. We've also asked for policies and procedures, and we'll have administrators provide us with copies of emails. Sending an email to your staff about a new process is not a policy and procedure. A policy and procedure should be kept structured. It should have an effective date. It should have, what the title of the policy is, what the actual processes are. Then you need to educate your staff on the policies and procedures and what the process is, and give them time to get acclimated to it. But then you also want to monitor it for effectiveness and applicability. Sometimes you could have policies in place that doesn't work with your workflow. You have people that, they have the boots on the ground. They're the ones that's working hand on hand with the patients, and they know, what needs to be done step by step. Ask them for their input and let them have a part in building the policies and procedures. And that helps build a policy and procedure that will help build a corporate compliance program, right? You want to have a great compliance program, and everyone needs to be involved with compliance. Compliance is not just a compliance officer or an administrator job. It's everyone's job. Give everyone the opportunity to ask questions. And most importantly, when you have a policy and procedure in place, you want to have an attestation process. And an attestation needs to say on there that they have read, acknowledged, and understand the policy and procedure, and they've had an opportunity to ask questions about it. And very, very important, never have a policy in place that you do not follow.
Yeah, and that's really critical. I mean,
Can't stress that enough.
Yeah, I mean, there's so many requirements, regulatory, right? Policies are developed on regulations, right? So we know that there's a lot of regulatory requirements and oversight from all of the different enforcement bodies around your medical records. So I think that's a really critical component. And we want to talk about education. How important is that? We talk about educating on, the policies and educating on the processes. And that's staff and providers and everyone else who has a hand, or it may be appropriate or applicable for in any sense of the organization. And don't just do training and just assume, okay, we did our training, everybody gets it. Ask questions, right? You may have a formal process, or you may have an informal quizzing component to the end of your education. Ask questions. Make sure that people really understand what you're training or educating them on. Okay, this one I always get up on my soapbox here, because I can tell you through all of our years of experience, we do a lot of work with the Garfunkel attorneys. Unfortunately, for providers and organizations, hospitals, AMSURG centers, urgent care centers across, the nation that, run into issues. And so much of it really boils down to the documentation. Like, we can't stress enough how important it is. Auditing, I feel, even though, we're talking about best practices and improving your processes, I think, to me, the auditing, I'm so passionate about it, is the most important component, because you can create policies and you can implement them. You can do training, but unless you're auditing those processes to test for effectiveness, you could be implementing them for nothing, right? They could
right.
be useless unless you're looking and checking to say, hey, this is working. This is not working. We need to revisit this, right? So really important. Auditing helps you to identify and correct issues early. Again, it's different, as Michelle said, it's different than monitoring, right? Monitoring is your day-to-day. Auditing is your snapshot of, hey, what happened over this period of time? Again, you don't want to do it once a year, because you don't want to wait till the whole end of the year and go, wow, we've been doing that wrong all year long. You want to have a process, an established process. Set a benchmark, set your benchmarks, and then put some re-audit protocol in place that says, hey, our expectation is we're going to have this percentage of pass rate. And if we're not there, then we're going to implement corrective action. We're going to look at opportunities for improvement to mitigate our risks. And then we're going to have a re-audit protocol in place. Again, think of the wheel. And it's so critical to go back to the root cause of problems, right? That's a big component of any process or compliance program across any organization. You have to get to the root cause. It's like you can't put a Band-Aid on a hemorrhage and expect that to fix the problem, right? One thing we just wanted to share a little bit is you can develop your own internal tools, right? So we have tools that we use when we do our audits because it's just critical. It keeps you focused, doesn't let you go down a rabbit hole. You have to have your processes in place. What are you going to be looking at? This is all a great component of your risk assessment, right? Identifying all the things that you need to monitor, audit, look for. These specifically is just a snapshot of the tool that we use for the medical record components that are required, both under the conditions for coverage and New York State. For us specifically, we do a lot of work in New York State with the Article 28 ambulatory surgery centers. So while you have your federal requirements and regulations, there are also state guidelines that centers need to be following as well. Michelle, great segue. Do you want to talk about signature requirements and how important that is in the medical record?
I sure do. And, first of all, I'd like to share a couple stories with you. There's been times where I've gone out to, perform an audit, and I've actually had to ask if a provider went on maternity leave because there was such a large gap of time in between when they saw the patient and when they signed. And sure enough, they weren't on any type of maternity leave. They just forgot to sign the note. So, there are tools within your EHR that you can use that will help to track, unsigned notes, and we highly recommend you to use those tools. All services provided to beneficiaries, they're expected to be documented in the medical records at the time they're rendered. And all medical record entries must, there's Alicia's word, must include, among other things, the date of service and a legible, dated, and timed signature of the provider. So what exactly is a valid signature? According to CMS, a valid signature must be for services actually provided or ordered, needs to be handwritten or electronic. In cases where a provider can prove their inability to sign due to a disability, they may use a stamped signature. Also, what they have on here is that, for late signatures, you can provide a late attestation, okay? But one thing we want you to remember is orders, right? So with an order, that communicates the need for a patient to get a test, a procedure, or some type of piece of equipment. Therefore, the order needs to be signed promptly, and in some cases prior to the services being rendered.
Yeah, and orders absolutely have to be signed, and that's a key component that everyone should be monitoring for within their medical record. Orders have to be signed, right? As well as, yes, can you potentially submit an attestation? You don't ever want to have to do that. You want to keep on top of your providers. Medicare is saying that timely signature 24 to 48 hours, right? They're giving you a time frame of what they consider timely. And you really want to keep on top of that because you don't want to be chasing down providers. Just having everything signed timely within 24 to 48 hours, make that your policy. Audit for that. Hold providers accountable when they're not signing timely. That's really critical. Okay, now I know we don't have a lot of time and we're covering so much information, but we want to take you through some coding strategies and some best practices. Again, this all boils down to the medical record, to the documentation in the medical record. And AmSurg centers have their own system, coding system for reimbursement, much different from pro-fee or professional coding, inpatient coding, outpatient coding. There's so many different rules and regulations around this. And today we want to talk about the structure of some of those notes, just, making sure that you understand, like, commercial plans may or may not follow CMS policies for claim filing. So understanding the process of what's required. You have to submit on a UB 04. Can you submit on a HCFA? What are the policies? What are the codes? Are they bundled? Are they together? All of those things may be different across different types of payers. So again, just setting up your process around documentation, capturing all the information you need, supporting medical necessity, having the same structured processes in place. You should be doing risk assessments, right? Risk analysis. Here are the procedures that we perform. Here's where the risk lies. Once Dan Levinson, the old Office of Inspector General, the IG, he would speak at our annual compliance conference. And he always used to say, what? Like, you don't know where to look for your risk, right? Dan, right? He used to say, look at the money, the revenue, that's your highest risk, right? I mean, there's so many things that are potentially a risk, but today we're talking about coding that impacts the revenue. The revenue is a huge high risk area because it's not about getting paid, it's about staying paid, right? And Michelle, just because you get paid doesn't mean you should have. So these are acronyms that we love to share. So again, processes in place, do your risk analysis for all of the procedures that you perform within your center. Have policies and procedures around your revenue cycle integrity, right? That's critical. Education across the board, so important. Your providers and your coders, nurses, everybody needs to have the same understanding. And then again, auditing is critical. Michelle, you want to talk a little bit about, this is kind of simplistic, but I always think it's important. Like, let's just start at the bases, let's start at the beginning and then we'll build on that. So.
Right. When they're submitting a complaint, a claim, it's so important to ask questions such as who's the provider that performed the service? Who's the patient that received the care? It does sound basic, but you'd be surprised how many times there's discrepancies on the CMS 1500. What is the CPT code? What is the HCPCS level 2 codes? Are they reported to identify the services performed and supplies used? What about modifiers? So many times, you'll have a prolonged service and the modifiers not used. That provider performed that service, they deserve to be paid. The where, where's the location of the services that was rendered? In addition to where, what about the patient site location? Is it on the right? Is it on the left? The when, the date of service, the why, what's the reason for the services being performed? What are the ICD-10 codes that are used to identify the diagnosis treated? So important.
I can't, we stress enough sometimes, just like we find some, not humor, but, we're sarcastic a little bit about the policy procedure books, but also coding books. Like sometimes you're going like, hey, do you have a coding book? Yeah, it's from 10 years ago. Make sure you have up-to-date coding material, tools and resources available. The new ICD-10 codes come out October 1st every year. This year's, there's 133 pages in the guidelines alone, right?
Right.
So things change, and it's really important that you're keeping up with what's changing in the industry. Okay, yeah, so again, medical necessity. Michelle, why don't you talk about this piece?
I sure will, because medical necessity is the driving force for, the claim. If it's not medically necessary, then why was it done? That's exactly what the auditor is going to ask. Why did you do it if it wasn't medically necessary? How can I look at your documentation and support the medical necessity of the procedure that you did? So imperative. So, it's one of the most important requirements to receive payment for services. And you need to determine the need for care, knowledge of the emergent nature or severity of the patient's complaint or condition. Is it exacerbated? Is it severe? Is it chronic? Is it acute? All signs, symptoms, complaints, or background facts describing the reason for the care. The facts must be substantiated. Is it substantiated by the patient's medical record and that the record must be available to payers on request? That's so important, isn't it, Alicia? The payers ask for the records and they don't have it. Boy, that's a huge red flag.
Yeah, or they're not complete or accurate,
right,
or thorough or timely, right?
Right.
And I think that's a good time to point back to the word must, right? You must substantiate the medical necessity in the patient's record. How do you
must
do
tell
that?
The patient's story.
Yeah, I mean, you're
don't you agree?
communicating
I mean,
that.
if it has to tell the story.
Yeah. And communicating that information electronically through your ICD-10 codes, make sure that you're coding to the highest level of specificity as well. And I think this number 3 here makes a good point, right? Make sure your documentation supports the services that you're rendering and you're billing for. So your diagnosis code that you're submitting has to be supported and match the information in your medical record. How many times we've seen that? That
right.
is something you should be very mindful of. Don't submit, codes just to get paid. The documentation has to match up with the billing here. Okay. Right. We do want to take you through, an op note and just kind of give you some advice, some suggestions of things that you should be making sure are actually in the body of the op note. Again, because payers have a contractual obligation to enrollees, and they don't want to pay for services that are, 1, not medically necessary, 2, that are not coded correctly, 3, that are not reported correctly for the site of service, and 4, that are appropriate for the treatment of the patient's condition. You can bet that they're going to be, and they have the right to, as we were saying, request that additional documentation, right? That's really critical. All right, so again, the dictation, so many problems we see when the dictation is incomplete or it's unclear, right? You can't have a 3-hour surgery and 1 paragraph in the record. That's never going to accurately describe what happened during the patient encounter. So the physician can't rely on their coder or an insurance adjuster or adjudicator to be aware of the details of a procedure if they're not fully explained or included in the report. And I think this is critical because Michelle and I talk about this together all the time. We can't just assume that people know what we know, right? When we talk about things, sometimes we talk in a way like, hey, you know what I know. But from the perspective of the physician documentation, auditors cannot infer or guess or
assume
anything. You've got to tell the story, right? The doctor has to tell you exactly what they did. And again, the complete details in the documentation make the decided difference in the coding and consequently the correct reporting of any surgical procedure. So we just want to give you some suggestions, take you through the components of the note. Again, dictation has got to match the seriousness of the circumstances and the procedures, right? If there's extensive complication, then use the terms or the words extensive complications, right? There should be indication of what aspects of the procedure were unusual or complicated. Was there any abnormal anatomy? Were there extensive adhesions requiring surgery time longer than normal because you're doing lysis of adhesions? Well, yeah, we know it's normally included, but if it's complex or complicated or above and beyond, all of those things are critical to correct coding. Words and phrases such as very difficult, it was complicated, it was an unusual circumstance, it was extensive, or, there were multiple, or ordinary, it was uncomplicated, and it was simple. And all of those terms help to verify the appropriate codes, appropriate modifiers that describe the services that are actually being rendered. Okay, again, we talked about modifiers. This is another area you should really have a watchful eye over, right? Understand, communicate what are appropriate modifiers in our type of, in an AMSurg setting, because not every modifier is applicable to everyone, right? So you have to know what is appropriate for you and then how to use it. And remember, modifiers are 2 digits that are appended to a claim line that send additional information off to the payer when they're electronically adjudicating your claims. So super important to make sure that those are accurate. The length of time that you're spending on a procedure, right? That's really important, specifically if you're spending, you know, extended time or you have an unusual situation. This is really important, you know, and this goes back to just standard coding practices for depending on the types of services that you're rendering. But anytime you're doing repairs, whether the repair is simple, intermediate, or complex, all of that information has to be captured in the medical record. The layers of skin, subcutaneous tissue, down to the bone that are involved in a procedure should be documented, because in some cases, the depth of involvement is going to determine the code that you're going to select for the procedure. And then, you know, for lesion excisions, there's specific rules around them. You know, specify the diameter, you have to multiply the margins, all of those things. Time spent in prolonged attendance must be documented. You just can't bill and assume that if it's not documented that it's going to be known. And then any unusual circumstances or the use of special aids or equipment, again, operating microscope, fluoroscopic guidance, all of that has to be captured in the documentation. Okay. So some key takeaways, we're hoping that while we went through the components, again, pretty much at a high level, be aware the things we talked about today are, you know, at least you need to have those components in the record, but each one of those areas, specifically even just like the anesthesia section or the discharge section, you know, there's a lot of elements and requirements that are required in those different sections. So just, we want you to be aware, understand that, you know, you're under scrutiny from both, you know, federal, state, and accrediting requirements. Accurate and timely documentation will save your tush, you know, in the event that you are audited or someone requests a record. Really important to make sure on top of that. Submitting claims with appropriate codes and modifiers. We know the health plans are always out there, health plans, looking for their aha moment, right? We gotcha. They love that. And they're always looking for low-hanging fruit. So don't let yourself be low-hanging fruit. Implement these processes, you know, make sure you're checking for bundling, unbundling, get your controls in order, follow through on your corrective action, and then, you know, stay aware of all the industry changes. And we know it's a full-time job. We do it all day long, every day, staying above, you know, out in front of things that could really have a big impact on you are critical.
Yeah, I just want to tag on to that, you know, the importance of the control measures. You know, so, you know, we talked about control measures, and, you know, it could be overwhelming to some of you, you know, because you need to have your control measures in place. You need to have your appropriate auditing and monitoring. You need to have your training and education. And sometimes that can be overwhelming to you. And it's important to know that there are third parties out there that can help you.
Oh.
Imagine
really?
that, there's our pictures.
No. Oh, joking, but it's so important. Listen, we say even in our day-to-day, right? You know, nobody can know everything. We're so busy with so many things going on. Yeah, you're going to be doing your internal auditing. You know, seek outside help for your external auditing. It's so like 2 heads are better than one. More eyes on oversight are always helpful. So yeah, so great. So we thank you so much for tuning in today. We hope the information we're providing to you was valuable. You'll be able to take back some of our information and implement it in your practice. Again, just stressing the importance of staying on top of those medical record requirements, making sure that all the services that you're billing for are supported in the documentation is really key to success. So thank you so much for tuning in today.
Thank you, everyone.
Seeing you again. Great.